A 22-year-old female presented with a history of painless breast lump. Painless breast lump in the left upper quadrant. She undergoes surgery, resection of all tumor tissue, and the HPE is being shown, histopathology, and there is a 4 mm clearance of the margins. Now you got all the clues. This is the typical histology. You are able to see necrotic cells, right? Necrotic cells over here. So what is the treatment that you want to offer for this given scenario? Oh, sorry. Is it adjuvant chemotherapy, adjuvant chemoradiotherapy, only adjuvant radiotherapy, or no additional treatment? What is the treatment that you want to offer? Good. Actually, answer is shown up. So, it is a high-grade ductal carcinoma in situ. High-grade ductal carcinoma in situ with a central comedo type of necrosis. Yahan adjuvant radiotherapy is the one which is being preferred in view of the 4 mm of clearance that it is showing, 4 mm clearance that it is showing. Now, doctor, a 56-year-old patient comes to casualty with a history of massive hemoptysis. His chest X-ray is being shown to you. दिल लगा के देखो कुछ दिखता है क्या? कुछ दिख रहा है क्या? हाँ. So, his chest X-ray is shown. Which of the following maneuvers is not done to prevent hemoptysis in this given case? Yes. What is your answer, doctor? In this given case, where the chest radiograph has been shown to you, yeah. I'll show you the radiograph once more. Have a clear look. What's your comment on the radiograph? So, which is not done? That means remaining are all done. So, what is your answer? Radhika Pillai is proposing B. And Akash Yadav says B. Manoj Sinde says C. Alok Singh B. Dragon Dream say B. Very good. But Rituraj, Roshan, Yadav, they are proposing lobectomy, right? See, doctor, what you are seeing here, this is a normal X-ray, doctor, normal radiograph. Normal radiograph जब रहता फिर भी hemoptysis है समझो. Then where is the pathology? Pathology is not there in the lung parenchyma. Pathology is inside the bronchi for the source of hemoptysis. There's a reason always when hemoptysis is there, get a radiograph. If there is any abnormality seen on the, or like a mass lesion is seen in the parenchyma, then you need to do lobectomy, etc., etc. But if there is no lesion seen, radiograph is normal, as in this case, you need to do bronchoscopic laser cauterization or pulmonary artery embolization or the bronchial artery embolization. There are all the various treatment options is what you need to remember. Now, doctor, in the patient as shown below, chest X-ray closure has been achieved. What is the flap which is being used for that purpose? So this flap which you are able to see, right? So this is the flap used on the chest. So the question is, what is the material used to do this closure? What is the flap which is being used? So what is your answer, doctor? Very good to see 72. Aaj 100 aana chahiye, right? So on Sunday, I told you I was going for second show movie, Super 30. I was having tears watching Super 30 because in 1999, when I started coaching, I was myself preparing for PG medical entrance. There used to be a small school, about 150 students from Usmania, Gandhi, Deccan Medical College. Already I was a popular writer of MCQ books in MBBS days. So they were all sitting in the class. I myself, they know that, was preparing for entrance exam, right? So early morning, 4 o'clock, I used to come and draw all the illustrations on the whiteboard. And I never, even those days or any day, money is a byproduct. So my students, somebody used to pay 100 rupees, another 500 rupees, another 1000 rupees. Maximum was 1000 rupees fee. So that batch, in the 100 ranks, 84 ranks came to all our students in 1999. So I still remember by face each of those students who spent 6 months with me and made me to become a successful teacher. So let me really, while watching the Super 30 movie, I was having uncontrollable tears. So I should thank all you students that because of you, every day evening is an eventful time for me to spend with all of you. So thanks for coming to the session, and let's hope that till January, until the NEET exam, we'll all be able to journey together to get inspired every day to finish as much as the high-yield topics which are frequently tested, we try to cover up, right? So doc, you should remember it is pectoralis major myocutaneous flap, which is being used. Now doc, a 1.5-year-old child. Thank you, Deepika, that always to prepare for a class or to prepare new MCQs, image-based questions, or to prepare a mock test paper, always I remember you and I remember myself as a aspirant of exam and prepare the question paper, right? So a 1.5-year-old child was brought. This is the typical lesion. Have a look at it. Now, there's a history of burn by the hot water on both the hands and palms. Lesion is shown. What is the best management of this case? Question number 25. Should your answer, doc? Alok Singh is proposing apply 1% silver sulfasalazine ointment. Manoj Shinde is also agreeing with that. What are your other chances? Satya proposes paraffin gauze and dressing. Absolutely. Absolutely right. Paraffin gauze and dressing. The lesion was pink, oozing, painful to air and touch. Now doc, a young boy presented to the casualty with a history of fever. Good to see you, Monica, once more today evening. Yes, there's a history of fever, pain, abdomen, vomiting. On examination, he was febrile. Pulse rate was 104 per minute. And the resident was eliciting, let us say commandant is eliciting this in Armed Forces Medical College casualty. So what is that commandant is trying to elicit in this? Should your answer? Yes. Manoj Sinde, Malakrishna, Radhika Pillai, all of you are proposing C. McBurney's tenderness. Absolutely right. Absolutely right, doc. A patient underwent laparoscopic cholecystectomy. and was discharged on the same day. On post-operative day 3, he presented to the hospital with fever. We have done a ultrasound. So this is the gallbladder, right? This is the gallbladder, and yeah, good. Now this is the gallbladder, and looking at this gallbladder, ultrasound, what is your next line of treatment is a very important question. Very good. We have 80 online students. Call your friends. We are going to have 2-3 sessions in November, December, May, 2-3 interactive sessions across the day to be constantly with you, right? I will not let you to stop reading. You know, that's a goal. Now, doc, yes, Hiren is proposing C, and Russian P is proposing B. Alok Singh also says B. Yeah, what is your answer, doctor? It is the pigtail insertion and the drainage, which is the one which is a preferred treatment, right? The ultrasound was showing the collection with fine internal echoes in the gallbladder. Now, a middle-aged old female presented with recurrent bloody diarrhea. Okay? Colonoscopy reveals multiple geographic ulcers, and histopathology is being shown to you. Colonic histopathology. So, in the histopathology, one of the important things is you are able to see a lot of inflammatory cells getting accumulated, right? So now, what is your diagnosis? Question number 28. Animation is proposing D, Madhu D, Shweta A, Shweta is proposing A, Alok says B. Very good. So, and Ritu says Crohn's. Excellent. It is a granuloma in the mucosa, which is a classical feature of the Crohn's disease. Now, you are being shown the histology and the imaging, right? Histology and the imaging. Looking at this histology and imaging, what is the question is maximum risk for this condition is seen in which condition? You are able to see the histology, right? Histology. So what is your answer, doc? Where do you see the maximum risk for this condition? Should your answer, doc? Yes. Question number 29. A. Manoj is proposing C, Putzaga. Putzaga. And Radhika also says Putzaga. Absolutely. It is a histology of the carcinoma pancreas. Carcinoma pancreas. So, the maximum risk for that is with Putzaga. Now, 55-year-old patient presented with dysphagia, and this biopsy has been taken. Biopsy has been taken and identify the diagnosis. This is taken from the upper GI of biopsy of esophagus, It is being shown to you, right? So looking at this histology, you should pitch on a potential diagnosis. Question number 30. Mention the question number, doc. Yes. Satya Snigdha Tripathi is proposing C, and Vishalakshi is proposing C. Very good. Vanishri C. Shweta says C. Very good. So you should remember it is Barrett's esophagus. Barrett's esophagus is what you are able to see. Now, chest radiograph was missing. Okay. Let's take the question number 32. A middle-aged male presents with fever and diarrhea for 1 week. A middle-aged male with fever and diarrhea for 1 week. And there is a acute onset of pain. Very important clue. And a erect abdominal X-ray has been taken. You are able to see the typical border. Yeah, this is a very important clue. You are able to see the border. Yeah. So what is your diagnosis? In this middle-aged male patient presenting with fever and diarrhea. Yeah. Shoot your answer. Question number 32. Shweta and Vishalakshi, everyone is saying C. Anvesh is proposing D. Acha. Anbeshan. Okay. Very good. Ranjit is saying that मुझे एक dilated large intestine दिख रहा है. बढ़िया. So is it A or D? It is typically D. The toxic megacolon is what you should remember. So that completes the quiz, doctor.